Hi, Monica. See that you have joined. Hi out there, Facebook people. See if I... All right, we are waiting for Dr. Ambro. We're going to get started here soon. Hi, Kelly. Can you guys see me and hear me okay? Okay, got it. Guys, give me 1 second. Okay, so register for that, and once you register, it'll send you the link to, and yeah, just register. Okay, I am back. So we are just here waiting for Dr. Ambro. He was actually having some trouble logging in, and that was him on the phone. So he is on his way. There he is. Let's see. See if I can get him on here. Okay, can you hear me, Dr. Ambro? You see you are on mute. Oh, there you go.
How are you?
Good, how are you doing?
Doing great. Oh, this is totally different. I'm trying to get this so those lights aren't blocking everybody. Yeah. Let me see if I can turn this light off.
Okay.
How's that? Pretty good?
All right.
We still waiting on some folks?
Yes. You know, so I am actually live on Facebook too, and I am getting some crazy feedback between Zoom and Facebook, and it's like a delay. So I'm like, okay, how am I gonna do this? Let's see if I can minimize Facebook and if that works. Okay, can you hear the feedback or is it just me?
I can hear the feedback on your computer.
You can? Okay. That is a problem. Okay, so what I'll have to do, I might have to stop the live stream on Facebook and then we'll just have a discussion and then I'll just post it on Facebook later. So Facebook guys, if anybody is on, I'll have to post it to Facebook later. All right. Okay, so I think we are good. Wait. Okay, there we go. Are we live now? Can you hear me? Are we good?
I can hear you.
Okay, awesome. All right, well, thank you, Dr. Ambro, for doing this for me. I really appreciate it. So I actually have some slides that I'm going to pull up to get us started here. Let me see. Give me 1 second. And I will share my screen. Okay, can you see?
I can.
All right, awesome. Let's go into present mode. Oh, there we go. All right, so thank you everyone for joining and welcome to Scar Talk. I am Amira Barker, the founder of Scar Power, and we are here with Dr. Ambro, facial plastic surgeon from Annapolis, plastic surgery to discuss keloid and hypertrophic scars. So the agenda, here's the agenda for this evening. So I'll do a quick background about myself and my story, give you guys a very short version. We're going to talk about how I got my scar, how I came up with the concept of Scar Power, and then I will introduce the wonderful Dr. Ambro, and we'll get into some discussions and get some of your questions answered. So there will be a Q&A at the end. If you are joining through Zoom, there's a Q&A box in there that will that you can click, and that will allow me to open up the box and have all the questions in one space. And Facebook, we're going to go ahead and post this to Facebook, and they can email me later if they have any questions. All right, so about me. So rather than giving my whole life story, I just picked a few items. So I am from East Orange, New Jersey, originally. I have been in Maryland for about 22 years. My day job, I am a business analyst, a contractor for the government, and I'm a certified project manager. And I have an absolutely amazing 13-year-old son. He's straight A student, plays travel baseball, plays basketball, and he'll be doing that in school soon, and I am very proud of him. I know you're probably mad at this picture, but I thought it was cute. And in case you were wondering, yes, we're both standing up, and he is taller than me. Kids grow very fast. And as you can see, I was a Baltimore Ravens cheerleader back in 2005 and was actually featured on the cover of the very first calendar. And so I'm not showing you guys this just to kind of toot my horn, but although it was a very proud accomplishment of mine, but I wanted to show you that, you know, I had an image of myself and, you know, how I was supposed to be back then. I always loved to dance and model. And so when I got the scar, I took a good hit to my self-esteem, you know, and I lost, I call it confidence points or cool points. So I've definitely lost a few cool points with myself. And so now I'll kind of go through how I got the scar. So I used to wear a small cross diamond pendant, which was kind of sharp on the edges. And so it scratched me right in the front of my chest. And so the scratch then healed as a keloid. And as you can see on the picture on the left, it started off very small. And over the next year or two, it started to get a little bigger. And probably by the time I decided to get plastic surgery, it was probably the size of maybe 2 or 3 of those, which still not that big, but I was self-conscious about it, and I decided to, you know, do plastic surgery to have it removed. The doctor told me to use a cream called Aldera cream, and this cream gave me a huge chemical burn on my chest, which was very painful. I remember having to go to the emergency room a couple times because it hurt that much. And so then that burn then keloided up. And so now I was left with 100 times worse scar than what I started with. And initially I went to dermatologists and started doing steroid injections, which were very painful because they had to do it with a needle. And because the scar was so big, I had about maybe 10 different shots in it at one time, which usually left me crying after the appointments. So of course I started to look for something different or a different solution, and that's when I found Dr. Ambro, thankfully, who has been amazing working with me and the scar. So we actually did 2 additional surgeries to try to remove the scar. We did it in sections because we didn't want to excise it all at the same time. So then that would, I'm sure, would have ended badly. And so while it was healing, we were going to inject it with steroids, so in the hopes that it would heal flat and not rise again. But I think after the second surgery, the scar started to keloid again, so we just decided to leave it alone, and we have been doing steroid injections ever since. So now going on 12, almost 13 years now, I get steroid injections every 2 to 4 months. I think I come to you, and I was there yesterday, so long time no see. I think last year was the only exception where I didn't see you for like over a year because of COVID. But I have been pretty consistent in coming to you over the past 12 years. So some parts of that did begin to raise again, but I think overall, I would say about 80% of the scar has stayed flat for a number of years, and there's only like a few sections that still keloid up, that I have to get the injections for. So I think all that work kind of paid off, coming consistently. So the last picture of me in the black is now how it's going. So after 12 years of being stuck in my scar story, I realized that something needed to change. And so that change was me. So in January of this year, I started to do some major self-development. I don't know if you guys ever heard of Tony Robbins, one of the biggest self-help, self-development teachers out there, but I attended about 4 or 5 of his seminars between January and May. So I took lots of notes, lots of journaling, meditating, and exercises that helped me, better understand myself. And one of the biggest things that I learned through all this was that I needed to grow. And so I needed to grow me, I needed to grow my life, and I needed a change. And so the other biggest thing that I learned was that my number one thing that was impeding my growth was my scar. And because for so long, I felt trapped inside of my body, hiding myself from the world, hiding from other people, and I'm feeling very insecure about the scar. And so when you feel insecure, there is no way that you can feel confident to take on new things or, to be at your highest level. So all of this self-development helped me to drastically shift my mindset in the way that I thought and the way I felt about myself. One of the concepts that kept coming up in these seminars was find a role model, right? So someone that does what you want to do, and then you just model it after them. The problem was that there were no role models out there that I knew of that was showing their scars freely and, saying it was okay to have a scar and just be yourself. So that's when I had the thought to just become my own role model. I wanted to create content for myself to help me overcome my insecurities about my scar. And I thought if that was the case, then I'm sure there were other women out there that was dealing with the same thing, feeling insecure in themselves because of a scar. And I realized that I can also help them too. And so that was when I had the idea of scar power, and it has been a whirlwind since then. So from May to August, I worked very hard setting up this company and all the different aspects that you see here. So what I did initially was ask myself, what are the things that I needed to see or to hear or to feel to make me more comfortable about my scar? And so one of the things was the Scar Power apparel, which is my logo that I have on the t-shirts. And so when you have a scar, that's the first thing that people see, when they judge you in their minds, and then you see them judging you, and then you judge yourself, and then all the negative feelings start, right? And so then you get all of those trapped inside of you. So I wanted to kind of create a statement. So when people saw me, yes, they did see the scar, and but then they would see scar power. And now that was a different conversation that they had with themselves in their minds, like, okay, I get it, she knows she has a huge scar, but she's embracing it, and she's confident about it. So that's what I kind of wanted to show, and to everybody with the Scar Power apparel. So whenever I wear my shirts, I hold my head up high, and I don't care what people think anymore. And my other offering is a power books, a mastermind book club. And because self-development helped me so much, it was a big part of my journey. This is my way to kind of give back to self-development world. I wanted to build a community of women that learn and grow together and support each other in their journey, help change their mindset and build confidence by reading and discussing amazing and thought-provoking books. Another aspect is my blog. I always loved to read and write. English was my favorite subject in school. So a blog seemed natural to share my journey and my thoughts and my lessons and inspiration with all of you guys. And then I have a Scar Lights. Because this company revolved around me and my story, I didn't want it to be just about me. I mean, I know you guys would be tired of seeing my face all the time and pictures every day. So the Scar Lights are a way for me to showcase other women and for them to share their scar story. So I am always accepting submissions for Scar Lights. So if you guys are interested, you can go to my website at scarpower.co and sign up to be featured. All right, and so last but not least, we have upcoming events for Scar Power. So one, which you are on now, which is Scar Talk with Dr. Ambro. Another is the Power Books and Mastermind Book Club sessions. They're actually once a month. The next one is on November 10th, and we'll be discussing A Radical Awakening by Dr. Shafali, which is absolutely amazing and empowering book. So, and I've created a custom workbook that you guys get as a participant as well. All right, so my last scheduled event is Model Scars, which will take place in Baltimore on November 13th. And this is a photo shoot for women with scars. We get dressed up, we get our makeup done, and we confidently take pictures showing our scars. And I will be using these pictures for my websites and advertisements and social media content, things like that. So now I'm sure you guys are tired of hearing me talk. So I am going to introduce now Dr. Ambro from Annapolis Plastic Surgery. He is a double board certified plastic surgeon who specializes in aesthetic and reconstructive surgery of the face, head, and neck. Voted one of the top doctors of Annapolis by What's Up magazine this year, and he's been my personal doctor for the past 12, almost 13 years. And you can read more about Dr. Ambro at AnnapolisPlasticSurgery.com. If you want to make an appointment with them, you can get all your information there. So I am going to stop sharing my screen so we can actually see Dr. Ambro. And welcome, Dr. Ambro.
Thanks for having me, Mary. I appreciate it.
Yeah, no problem. So I know that you wanted to kind of, you can introduce yourself and kind of talk about, whatever you want to talk about before we get to the questions.
Well, I wanted to say thank you, and I think your whole Scar Power is fascinating, and I applaud you when you told me about this. And originally, I think was it a couple months ago that you had started that, and I said, "Listen, if there's any way I can help," and you say, "Well, actually, there is." It's truly my pleasure to be able to help and answer some questions, and hopefully, I mean, I can hopefully help some folks that are here tonight and answer any questions. But I was actually talking to some folks in the operating room this morning, and I said that I think that as a single patient in my 17 years of practice, I think I have seen you more than any other individual patient throughout that, and you've been very diligent in coming back, and always put a smile on my face when I see you in the office. But I'm glad to be here, and please fire away.
All right. So first question I have for you is, what is a keloid? And okay, so let's start with that.
So a keloid is an abnormal scar. I guess before I would answer that completely, I would say that I think it's important to understand what a normal scar is before we say what's an abnormal scar. I mean, so okay. For those out there that know, the skin is separated into two different layers, the top layer being what's called the epidermis, which is quite thin, about the thickness of a piece of paper. And then the bottom layer of your skin is the dermis, which is where all your collagen and your elastin and the ground matrix of your skin is a much, much thicker layer of the skin, and all the cells that are responsible for collagen production are located within that dermis. If you get an abrasion or a brush burn, that's just a partial thickness injury to the skin. You skin your knee, it doesn't create a scar. The only way that you actually get a scar is if there's an injury full thickness through the skin. So it goes completely through both those two layers of the skin, and that's when your body will make a scar. And there's a normal scar. Anytime you have that, you're going to have a scar. Now, there are different levels of like that scar kind of going awry, which is what brings you into like a hypertrophic scar or a keloid scar. So those scars are excessive scar formation, where the collagen that's being made to repair that injury to the skin is too much. By definition, a keloid scar is going to grow outside of the boundaries. It's sort of like a benign tumor of collagen production. And it will grow outside of the boundaries of the initial scar. So that's like the biggest determinant between what's a hypertrophic scar, and there's lots of other things we can talk about, but a hypertrophic scar will stay within the boundaries of the initial injury, a keloid scar will actually grow almost like a tumor growing, but a benign type of tumor of collagen production.
Okay. All right. So what's the difference between a hypertrophic scar and a keloid scar?
So hypertrophic scars can occur in anybody. They generally tend to occur a little bit quicker and sooner after the initial injury, whether it be like a laceration or an injury or an actual surgical incisional scar. They normally will occur within that first kind of 1 to 2 months, and it can be in any kind of skin thickness type, any kind of skin coloration type. There's really no person that's not have the possibility of developing a hypertrophic scar. They generally tend to, with time, slowly regress. So you can still be a little bit raised, but with time, a hypertrophic scar will gradually soften up or get smaller. It's raised. The hypertrophic basically just means it's raised above the surrounding surface of the skin.
Okay.
The keloid scar is sort of, if you think of like a scarring on a continuum, it's like the far kind of end where it doesn't necessarily happen right away. I see a lot of patients that have had, let's say, their ears pierced and they're fine. And then 4 or 5 years later, for some unknown reason, they start to kind of grow this mass, and it will grow outside, again, bigger than the actual injury. Keloids are a lot more common in people that have thicker skin. So kind of as you get down towards the equator on the earth, like those types of ethnicities, whether it could be Mediterranean, Latino, Asian, African, as you're closer to the equator, your skin tends to be thicker. The thicker your skin generally, and the closer to the equator, your skin tends to be a darker skin type. So you see those types of keloid scars being a lot more common, up to 20%, 20 times more likely in people that have darker skin types.
Okay. Okay, yeah, because my next question was, are they more prevalent in certain demographics? So it's like the darkest
So yeah,
skin.
much darker skin. They tend to run in families. Trying to think what else. More common in patients. You almost never see keloids in prepubescent patients. It's pretty much from puberty on, the highest incidence being kind of in the mid-20s.
Okay.
And then you tend to see them kind of like teens, 20s, 30s, and you start to see kind of a drop off in the incidence of keloid progression as they get into their 40s and older.
Okay.
Men and women, males and females, are equally as affected. And it generally tends to be in areas there are some anatomic areas of the body that are a lot more prone to keloids. The chest, as in your case, the shoulders, the upper back, areas where there's a lot more tension. You're constantly moving and that skin is under tension. You tend to see it a lot there. The one sort of outlier of that kind of area is the earlobes. Within the head and neck, it's the area that I operate, and tend to work on the majority of my practice. Earlobes are by far the most common area, and there's really no tension on that. So that kind of goes counter to almost everywhere else that you see keloids, in that there really isn't any tension, but earlobes are by far the most common area on the head and neck.
Okay. Yeah, because I know my son has a lot of scars from like baseball and stuff, and I just wonder if he'll start keloiding up at some point, because I don't think they are right now. But so you're saying that it's a possibility that he can form that later,
Yeah,
or
you can
have
see
that.
you can see it be years later, unfortunately. You don't tend to see them that often on the lower extremities. They're definitely more common. The chest, arms, shoulders, neck, ears. They tend to where you see them the most. Scalp as well.
Okay. All right. And so the next question, what are the current treatments, and is there any one recommended treatment over another?
Well, I mean, there's been a lot of different things that have been tried over I mean, I've been, I think I did my first lecture when I was in residency over 20 years ago. And unfortunately, I don't think there's been a tremendous amount of change. I mean, without question, anybody that has had a keloid and gone and seen a physician has been talked to about using corticosteroids. They're not the anabolic steroids that get you big and strong, but more of the anti-inflammatory ones that are going to, they're going to help quiet down thing. So if you think about a keloid, essentially, and again, hopefully this helps people understand, when your body's repairing itself, you're building collagen. At the same time, there's a very tight balance. Your body's also degrading or kind of taking away some of that collagen. So there's this balance of a normal scar formation. As your body, those scales kind of get tipped in keloids and hypertrophic scars, your body's tending to not, it's not like it's making more, it's the degradation process, which is sort of being down regulated. So the production is being unchecked and it's continuing to grow without your body breaking it down. So a lot of the medications, including corticosteroid shots, triamcinolone is the one that I use initially, that pretty much everyone has as their mainstay, is tipping the balance and kind of causing this sort of cellular cascade to kind of increase the production of the enzymes that break collagen down. So that's kind of how these medications that are injected into these thickened collagen benign tumors are working. I myself have and you've been here with my journey through finding other things. There's a lot of literature on the use of 5-fluorouracil. When I left an academic medical center, which was very hard to use, like off-label medications, and went into private practice, I was able to use that, and I've been able to incorporate that into the steroid injections. And then the steroids themselves can have, if used at too high of a concentration, can have side effects, not necessarily systemic, but side effects in that the skin can become thickened, it can become shiny. You can see, proliferation of vessels and makes the scar look a little bit more red. You can get hypopigmentation. Again, a lot of patients that I see that have keloid or hypertrophic scars have a darker skin type, and there's pigment in the skin, and that too much steroid can actually cause a lightening of that surrounding skin. So I've been, over the last 8 years, incorporating, kind of diluting that steroid down with 5-fluorouracil, which is actually a chemotherapy medication that has been published for the use of scars. It's not FDA approved for the use of injection in the scars. And the only reason why it's not FDA approved for that is that the FDA process, if anyone knows, is incredibly expensive. 5-fluorouracil is a generic drug, and no person that doesn't own the rights to that medication is going to spend $3 million to try to push a new indication for that through the FDA. So I use that off-label. Any patient that I inject, and I inject probably anywhere between 4 and 6 people a day. With that, they will, when the first time we do it, we have them sign an off-label consent form saying they're okay. I've never had anybody, I've injected my daughter, I've injected myself with it. I've never had any issues with it, but it is an off-label usage that I've found to be a really nice adjunct to typical steroid therapy.
Okay. So getting back to how the steroids work, so it just helps balance your body, like you talk about the balance between the collagen and the
production and degradation. Yeah.
Right. So the steroid just helps that process and not letting the keloid rise. It
sort of upregulates the kind of degradation process. Okay. Part of the reason why there's not a whole lot of new stuff, and this is interesting. I remember when I first started learning about this, is that there are no other species on the planet Earth other than humans that keloid. As a lot of anyone knows, that when they test out medications and disease processes, for a lot of animal work and animal studies are done before they then transition that into humans. There is no other animal that keloids. So it's really hard to conduct those type of studies when you don't have that type of model, a model that you do these larger studies with different things. So that's been a significant impediment on the sort of the science aspect of keloid scars and how to best manage them.
Mm-hmm. Okay. All right. So we talked about the steroid injection. What about like laser surgery and all that type of stuff? Have any thoughts about
I mean,
that?
you can go online and you can find or read through the literature and find lots of different ways. There's, cryotherapy, which is freezing it. Not a great thing. There's laser therapy, that's just sort of ablating it away. Really, the ultimate management is to remove, if you can. So the biggest thing is if you can get at a keloid scar early and get it kind of softened and prevent it from getting larger that would need to be removed, then that's your best option. And those injection medications are going to be great. Laser therapy itself, I've never seen any like great study that show me. There are studies out there. You can find a study that can support really anything. I've never seen any really great studies on laser therapy where they use laser assisted delivery of medication. So they're making sort of like these channels into the keloid with a laser energy, and they're applying topical medications into those channels. To me, it doesn't make as much sense. It's a lot easier and a lot more of a direct way to actually inject that medication into the center of that, as opposed to trying to make these channels, because certain keloids are going to be a lot bigger. And part of the problem with laser therapy is that for patients that are trying to have these treatments for their scar run through, like their insurance, their medical insurance, laser therapy is not covered. There's no laser code that exists that an insurance company is going to cover that. So it's, it can be, cost prohibitive for a lot of patients that are, just don't have that kind of money to invest. So I personally have not done a lot with laser. I don't think it's that great for it. Does that answer your question?
Yes.
Sorry, a little bit long-winded.
No, that's fine. And I know we talked a little bit yesterday about the vitamin D. I know you say there's like new research out there.
Yeah.
That
So
help.
just from you invite me to join you in your group tonight, it was it's always good to kind of go and look out what's some new. So I did a fair amount of literature search and looked at some stuff, and my wife, who is actually a dermatologist who sees a lot of scars as well, she had not even heard about this, but in the Journal of Aesthetic Dermatology, this just a couple months ago, in the spring of 21, they had done 2 studies that looked at vitamin D and how it affects the healing process. And any of these medications that are ultimately going to help with keloid, making them is kind of tipping that balance of collagen production and degradation back into more of a balance. But they looked at a group of patients that had small, like medium, large keloids, and then they checked their vitamin D levels circulating, like their blood levels of that. They found that the group that had the largest keloids had significantly lower amount of circulating vitamin D in their system. Again, obviously there's going to be more research that needs to be done. Darker skin types, right, because of the pigment that they have, tend to absorb less light, therefore tend to have lower vitamin D levels and can certainly benefit from more supplemental things. So I think I told you yesterday, right before I saw you, I was talking to another keloid patient that I've been taking care of for a number of years. And I said, listen, it can't hurt. It's good for your bones, good for your immune system. Start taking more vitamin D.
Right.
A group in Egypt then subsequently took that information and then actually injected vitamin D into a number of different keloid scars and noted statistically significant difference and drop in the size of that keloid, and they documented it with ultrasound as well. So I don't even know where I could find injectable vitamin D, as I was explaining to you yesterday, but it is something that is certainly interesting and worth following, as I think more and more people will start to look into that. And like I said, in the meantime, until more data, you don't want to go rush out and have people inject vitamin D into your keloids, but certainly taking a good daily dose of vitamin D. There's really no side effects. I wouldn't overdose on it because vitamin D is fat soluble and you can potentially take too much of it, but just your standard daily dose, by all means, it can only help and can't hurt.
Right. Okay. All right. Awesome. So what's the most affordable way to treat a keloid?
Well,
Your opinion.
I would say getting at it early. Getting at it early. There are the only scar gel or scar cream. Obviously, anyone that's has a scar and's gone into any Walgreens, CVS, Rite Aid, and looked in the skin aisle with scar gels, Mederma, et cetera. The only one's ever been shown clinically to ever have any real effect on keloid scars, and this study was based primarily on burn patients, were silicone-based ones, and the original ones were silicone sheeting. And I think you and I remember I used to give you the silicone sheeting, which you'd have to cut and you'd have this piece of tape and everyone could see it. Probably about 8 years ago, Biocorneum was the first company to come up with a silicone-based scar gel that dried clear and actually had an SPF in it as well. A small tube of that should last 3-4 months, typically runs around $40. That's something that can certainly be, so obviously if you have a large keloid scar, putting that on, it's not going to make much of a difference. But as far as someone that has a propensity for keloid scars, that has an incision or is starting to get some thickened, using that, massaging that twice a day, is certainly something that is reasonably affordable. On earlobes, it's very easy to do pressure. I have people get what are called pressure earrings that they wear. If you can wear that ideally for about 12 hours a day. So I tell them when they're sleeping or if they're, just spending time at home, that pressure beyond a certain point can be very effective as far as minimizing the recurrence of ear keloid scars. It's very hard to get a lot of pressure on, like say, like a scar on your chest. There's just not a way of being able to get that pressure. But on the earlobe, when you have a front and the back, and you can have essentially like a clamp that clamps onto the front and the back of the ear, can be very effective as well. And then just, again, just keeping up with, injections to kind of keep it small. The smaller it is, the much better it is to manage. The larger the keloid gets, the harder it is for that medication to get in to the center of that scar, and then therefore it'll continue to grow. That's probably the biggest bit of advice that I could give anyone.
Right. Okay. All right. Well, I think you just answered my next question. Are there any treatments that we could do at home or products that we could buy? And you said silicone gel, I guess, is the best, and then the biocorneum, right? Which I need to get more of.
There are others now that have followed suit. Biocorneum was the first, and they were shown to be clinically equivalent to the old school silastic sheeting. Here's your questions here. Those are pretty much the things I would recommend at home. Yeah.
Okay. All right. And so I think you actually answered my next question too, which was, is there any new research being done? And I guess explain that, because there's no other animals that have keloids than we are, they can't do like a lot of testing on it. Do you have anything to add to that?
No, I mean, I think you as you had mentioned in your intro this evening, is that as you know, I use a different sort of injection method. A lot of steroids are injected with a needle. Anyone that's ever tried to inject a keloid knows that it's an incredibly dense ball of collagen, and it's really, really hard to inject a medication into that, especially if it's large. We use a transdermal air gun. It's like a hydraulic gun that creates a puff of air that forces that medication even into a dense keloid scar. I've had hypertrophic scar on my own chest that I've injected. It's way better tolerated than a needle.
Yes.
It's calibrated in a way that it minimizes the medication being delivered too deep. So in a hypertrophic scar, or even an early keloid scar, you're not going to get that medication into that deeper dermal or the subcutaneous fat where you can get atrophy. So it's calibrated specifically to inject in the skin, and I think it's incredibly effective as far as delivering that medication. Not everybody has it. In fact, I don't know many people that do. I'm taking care of countless keloid patients, and anybody that's ever been injected with a needle that's come into our office and had that injection with that air gun has noted that it's a big difference as far as being comfort level.
It is. And so does other plastic surgeon use that air gun, or is that just specific to your office?
I mean, I found out about it a way as far as being able to, it was at one meeting that I went to and I saw it, and they were saying that you could, you know, anesthetize like kids in like the emergency room if they had a laceration and they didn't want to have a needle because everyone's scared of needles. It was sort of a way of doing that. And I was like, well, look, I think that would be a really good way to be able to see if we could use that to administer the medication. And so that's sort of how it started. I really don't know that many other people that use it. You know, it's worth at least calling, you know, if you're planning on going to see somebody, ask them if they have that. It's
Right.
not an expensive piece of machinery. I think the actual gun itself, only the air gun, maybe costs $100, $200. It's not that they tend to need to be serviced quite often. So we have like 3 of them in the office because we're constantly rotating one out to get serviced because we use it a lot. But I don't know a lot of people that do use it.
Okay.
It's made a big difference in my practice.
Yeah, so
and for my patients.
everybody go to Dr. Ambro. It's much better. All right, well, that was all the questions that I had. Let's see if we have any in the chat. Thank you, Kelly, so much for all of your chats. Okay, so it doesn't look like anybody have any questions. So I will, after I post this, I'm sure I'll probably get some questions and then I'll just follow up with you on it. Do you have any other information you'd like to share or anything else?
No, I mean, I said, I applaud you for what you're doing. I think it's really important for people to understand and know that there are other options. You know, keloids are a challenging thing. And obviously for any patient that has a scar like that, and as you described your journey with this, it's incredibly frustrating because keloids by definition really want to have a recurrence rate that is, as a physician, my job is to you know, make people happy and make people like look better. And it's hard because if you just remove a keloid and don't do anything else, I mean, if you read the medical literature, it's up to 70% of the time it can come back, and these have a tendency to want to come back. And for me, it's very frustrating for me, obviously for the patient more so, but for me as a physician trying to treat and make somebody better, it's tough. So my one word of advice would be is if you have a history of keloids or you are starting to develop one, you're much better off getting it looked at and treated early on. It's a lot easier to treat early on as opposed to letting it get to a point where it's bigger, because it's way harder to treat in a conservative, non-surgical way.
Right. And you know, actually, I do have another question. So, I mean, of course, I have keloid skin because I get them sometimes from like pimples, but I actually have about 5 or 6 tattoos, and I've never had any of them keloid up. So, the scars itself is just like, I mean, like sometimes I get it and sometimes I don't. So, there's no way I would know until I get it, right? I'm guessing that's
So
how
if you
it works.
think about if you think about it, though, as I was saying earlier, a scar is going to occur from a full thickness injury. A tattoo, which I wouldn't necessarily recommend somebody that's
Right.
super keloid prone. It's just it's using a small needle to deposit pigment into that deeper dermal layer. You're not really creating a full thickness skin injury that's going to lead to a scar formation. So, you know, there was obviously, I'm old enough that, you know, there was a lot of, you know, fraternities that used to, you know, the brand, their fraternity symbol in their arm, right? And that's creating the heat, and that's creating a hypertrophic scar. I've seen patients that had that then that subsequently create. So that heat injury created a full thickness injury to the skin to create that scar. Whereas a tattoo is just simply just depositing pigment in that deeper dermal layer. And that's the reason why you're not probably seeing that.
Okay. All right. Awesome. Well, that's all I got for you.
Fair enough. Well, thanks for having me.
Thank you so much. I appreciate it.
Yeah, it was my pleasure.
Yeah, this has been helpful. So thank you. And I will be seeing you soon.
All right, sounds good.
All right.
Take care, everyone.
Guys.
Take care. Have a great night.
All right, you too.
Bye-bye.
Bye, guys.